So welcome back guys. Now we are diving into the world of Cryptosporidiosis. It is a parasitic infection that affects millions of people in this world. So let's uncover the signs and symptoms, causes and prevalence of this illness. So let's get started. Cryptosporidiosis is caused by microscopic parasite called Cryptosporidium. This sneaky intruder can be found in water, food, soil, or surfaces contaminated with infected human or animal feces. Once ingested, it can wreak a havoc on our digestive system. But what are the signs and symptoms? Well, cryptosporidiosis can lead to a variety of gastrointestinal symptoms like watery diarrhea, stomach cramps, nausea, and vomiting. It's not a pleasant experience, right? Some may also experience weight loss, fever, dehydration, and general malaise. It is essential to pay attention to these symptoms, especially if they persist. Now, let's explore to the causes of cryptosporidiosis. As I mentioned earlier, it is primarily transmitted through contaminated water and food. Imagine swimming in a pool with inadequate sanitation or eating vegetables and fruits that has not been properly washed. These scenarios increase the risk of infection. Now, you might be wondering, how prevalent is this parasite? Let's take a look at the numbers, shall we? According to a comprehensive meta-analysis of 221 studies, the global prevalence of Cryptosporidium infection stands at 7.6%. However, it is worth noting that certain countries have higher rates. Mexico have the lead with a staggering 69.6% prevalence, followed by Nigeria at 34.0%. Bangladesh and Republic of Korea also showed a significant numbers at 42.5% and 8.3% respectively. So, who is most at risk? Well, our friends from low-income countries, individuals with gastrointestinal symptoms, and those under the age of 5 are more vulnerable. Additionally, residents living in non-urban areas face higher estimated prevalence rates. So, that's all from me. Moving on to the next presenter.
Assalamualaikum, my name is Nur Ishkramitisa. So now I will proceed with the diagnosis of Cryptosporidiosis. The disease is diagnosed by examining stool samples. People infected with crypto can shed the parasite irregularly in their poops. For example, one day they shed the parasite, the next day they don't, and the third day they do. So patient may need to give 3 samples collected on 3 different days to ensure that the result is accurate. Most often, stool specimens are examined microscopically using different techniques such as acid-fast staining, direct fluorescence antibody (DFA) or an enzyme immunoassays for detection of Cryptosporidium species antigen. Molecular methods such as PCR are increasingly used in reference diagnostic labs since they can be used to identify Cryptosporidium at the species level. Tests for Cryptosporidium are not routinely done in most laboratories. Therefore, healthcare providers should specifically request testing for this parasite. Furthermore, most people with healthy immune system will recover from Cryptosporidiosis without treatment by following a few actions that may relieve the symptoms, such as drink plenty of fluids to remain well hydrated and avoid dehydration. Second, maintain a well-balanced diet. By doing so, it can help in speed recovery. Third, avoid beverages that contain caffeine such as tea, coffee, and many soft drinks. And the last one is avoid alcohol as it can lead to dehydration. Over-the-counter antidiarrheal medicine might help slow down diarrhea, but a healthcare provider should be consulted before such medicine is taken. There is a drug called nitazoxanide has been approved by Food and Drugs Administration for treatment of diarrhea caused by Cryptosporidium in people with healthy immune system and is available with prescription. People who are most likely to become infected with Cryptosporidium includes children who attend child care centers, including diaper-aged children, childcare workers, parents of infected children, older adults at the age of 75 and above, people who take care of other people with crypto, backpackers, hikers, and campers who drink unfiltered or untreated water, swimmers who swallow the water from contaminated sources, people who handle infected calf or other ruminants like sheep. Cryptosporidiosis is normally not a serious disease in healthy people, but it can lead to a life-threatening illness for people with a weak immune system.
Assalamualaikum, I am Nur Syafiqah Ismail. Now we are moving on to the sixth change of Cryptosporidiosis infection. I will explain the first three chain of infection. So firstly is the infectious agents of Cryptosporidiosis. The infectious agents of Cryptosporidiosis is a microscopic parasite called Cryptosporidium. Cryptosporidium is a protozoan parasite that belongs to the genus Cryptosporidium. It is a single-cell organism that infects the gastrointestinal tract of humans and animals. There are several species of Cryptosporidium that can cause infection in humans, with Cryptosporidium parvum and Cryptosporidium hominis being the most common. Next, there are some common reservoirs for Cryptosporidium. First, human carriers. Infected individuals can act as a reservoir for the Cryptosporidium. People with Cryptosporidiosis can continue to shed the parasite in their feces even after the symptoms subside, potentially transmitting the infection to others. Second, livestock. Cryptosporidium infection are frequently associated with young farm animals such as calves, lambs, and piglets. These animals can shed large numbers of oocyte, contaminating the environment and posing a risk of transmission to humans. Third, domestic animals. Pets like dog, cat, birds can also carry the Cryptosporidium. Contact with contaminated feces from infected pets can lead to the transmissions of the parasite. And lastly, the fourth is environmental reservoir, which is contaminated water sources. Water play a significant role in the transmission of Cryptosporidium. The parasite can survive for extended period in water, allowing it to persist and infect individuals who came into contact with the contaminated water. Now I will explain the third change of infection, which is portal of exit of Cryptosporidiosis. The primary portal of exit for Cryptosporidium is through the feces of infected individuals or animals. Cryptosporidium oocyte, which are the infectious stage of the parasite, are passes in the feces. The shedding of Cryptosporidium oocyte in the feces allows the parasite to be transmitted to the environment and potentially infect other individuals. The oocyte are highly resistant to the environmental conditions and can survive for extended periods in water, soil, and other environments. Next is through the respiratory secretions. In rare cases, Cryptosporidium has been detected in respiratory secretions such as spitums and nasal discharge. The respiratory secretion can serve as an additional portal of exits for the parasite. However, the significance of respiratory transmissions in the overall spread of Cryptosporidiosis is not well understood and is considered uncommon. Lastly, through milk, Cryptosporidium has been detected in milk of infected animals such as cows and goats. Contaminated milk can potentially act as a portal of exit for the parasite, particularly in the context of unpasteurized or raw milk consumptions. So that's all from me.
Assalamualaikum. So the fourth out of the sixth change of infection is the mode of transmission. The most common mode of transmission for the Cryptosporidiosis is by the fecal-oral transmission. Fecal-oral transmission is a transmission that occurs when the route of exit from the body is in the feces, while the route of entry to the new host is via the mouth. As we all know, transmission can occur in two ways, which are by indirect contact and direct contact. From what I've mentioned just now, Cryptosporidiosis is usually transmitted through fecal oral transmission. This can be done either by ingestion or inhaling. For example, the prevalence of Cryptosporidium infection is more susceptible in the area that is lack in hygiene and sanitation. So, for those who ingest contaminated water like swallowing the swimming pool water or drinking untreated water can be infected. Not only that, but Cryptosporidiosis can also be transmitted via airborne transmission. This happens when a healthy individual inhales the aerosolized droplets from the infected person's cough or sneeze. This method of transmission is actually similar to the transmission of COVID-19. So that is why many years back, we have already been taught to cover our mouth when sneezing and coughing so that we won't spread our germs to the surroundings. Thirdly, although it's uncommon, but the transmission through animal to person contact is also possible. For example, the Cryptosporidium species that is commonly found in animals like sheep, horses, goats, and rodents has been reported, but in most cases, it's very rare. While for the C. canis and C. felis species from the dog and cat adapted species, they have been reported more to cause infection in individuals, but without showing any symptom. The transmission from animal to person is also true because the C. parvum species is often found in the infected intestinal of the humans and ruminants. So those people who have closer contact with a large number of animals, maybe like farmers, can be infected by the C. parvum species that I've mentioned just now. The transmission of Cryptosporidiosis is also possible with direct contact. For example, if one touches anything that has come in contact with contaminated feces, then they are at risk of the infection. That being said, the portal of entry for the Cryptosporidiosis infection to occur is in the respiratory tract. This is because of the bunch fecal oral transmission, which I have explained before. For the last change of infection, the susceptibility host is those who are most vulnerable to the Cryptosporidiosis infection. Generally, anyone that has made contact with the transmissions mode that I've mentioned before this, for instance like ingestion, inhalation, having close contact with animals, and direct touching can be infected. But those people who are immunocompromised, like having a human immunodeficiency virus, HIV and AIDS, cancer, or transplant patients are at a high risk. This is because the parasite will enter the intestinal after infection and then proceed to alter the function of the intestinal barrier, increasing its permeability, absorption, and secretion of fluid and electrolytes. So, the degree of the immunocompromised status of an individual determines the severity of the infection outcomes. And of course, the weaker the immune system is, the worse the outcome will be. That being said, the elderly and children can also be dangerously infected for the Cryptosporidiosis because they have a weaker immune system compared to a healthy adult.
Hi, my name is Ain Salsabila. Therefore, I would like to conclude our presentation today with the suggestion on how to break the chain of Cryptosporidiasis infection in the event of an outbreak. What should I do if I think I might have Cryptosporidiasis? For diarrhea, whose cause has not been determined, there are many actions may help in relieving the symptoms. Firstly, drink plenty of fluids to remain well hydrated and avoid dehydration. Serious health problem can occur if the body does not maintain proper fluid levels. For some people, diarrhea can be severe, resulting in hospitalization due to dehydration. Next, maintain a well-balanced diet. Doing so may help speed recovery. Avoid beverages that contain caffeine, such as tea, coffee, and many soft drinks. Avoid alcohol as it can lead to dehydration. And contact the healthcare provider if you suspect that you have Cryptosporidiasis. Okay, there is another way to stop the spreading of Cryptosporidiasis. How should I clean my house to help prevent the spreading of Cryptosporidiasis? By the way, no cleaning method is guaranteed to be completely effective against crypto. but we can lower the chance of spreading crypto by taking the following precautions. First, wash linens, clothing, dishwasher or dryer, save soft toys and itch that soil with poop or vomit as soon as possible. Next, flush excess vomit or poop on clothes or objects down the toilet. Use laundry detergent and wash it in hot water. For other household objects and surfaces, for example, diaper change areas, we remove all visible poop, clean it with soap and water, and let dry completely for at least 4 hours if possible, exposed to direct sunlight during the 4 hours. Other than that, wash our hands with soap and water after cleaning objects or surfaces that could be contaminated with crypto. The best way to prevent the spread of Cryptosporidiosis in the home is by practicing good hygiene. Wash our hands frequently with soap and water, especially after using the toilet, after changing diapers, and before eating or preparing food. However, alcohol-based hand sanitizer are not effective against crypto. Therefore, maintaining good hygiene is important in order to ensure that there is no spreading of cryptodiasis in our home and also in maintaining our health. So that's all from us. Thank you.